There was anxiety when Governor Brown left. They said, well, maybe the adult in the room had left the room. The adult's still in the room. We're holding the line fiscally, $19.2 billion of reserves, paying down 100% of that wall of debt.
When he talks about his spending plan, Governor Newsom leads with the savings. With a $21 billion surplus, much went into a rainy day fund and shoring up public pensions. But he's also proud of the spending. For K through 12 education, the state is spending more than $12,000 per student, the most ever.
The fact that we were able to put more money in special ed, put more money into full-day kindergarten, preschool, the fact that we're focused on after-school programs, and the legislature enhanced that part of the budget, I think is a very healthy thing.
Some parts of the budget are much more controversial. Californians will again be required to have health insurance and fined if they don't.
And one of those legs was vandalized by the Trump administration. They got rid of the individual mandate. By the way, that increased your premiums last year. Everybody watching had an increase of premiums. So California reinstilling that core component of the ACA is going to lower premiums or reduce the likelihood that premiums would have otherwise increased at a higher percentage rate.
And this is a first, expanding Medi-Cal to low-income, undocumented immigrants up to 26 years old. The governor argues emergency rooms have to treat everyone anyway. He says this will cost less.
Preventative care, wellness, costs taxpayers less than acute care on the back end. So from a fiscal perspective, not just a moral and ethical perspective, California being the first in the nation just makes sense to me.
On the 911 system, I think no one disagrees that the entire system statewide needs an upgrade.
Good.
People may be questioning why we need another tax or another fee to pay for that. And again, when we have a surplus in our state.
Well, it's ongoing. Every 911 system in the country, well, overwhelming majority, red states, blue states, this is how you pay for them. It's a user fee. It's how 911 has been funded. Nothing about this is unique or novel. We'd still have among the lowest cost 911 system in America by a significant margin. I'm talking about the lowest 3 or 4 states in the country.
As a dad, the governor has promoted what he calls the parents' agenda. The budget includes tax credits for low-income families, help with childcare, and it doesn't get more personal than this.
Your predecessor did not sign bills for tax-free diapers and tampons, and you did.
I got kids. Forgive me. I have an activist wife. I got 2 daughters, and also got educated. 14% of after-tax income for a low-income family is spent just on diapers. 1 out of 3 families struggle to pay for diapers.